Thanks very much. Good afternoon, everybody. So today I'm going to be talking about the intersection between the opportunity for innovation in healthcare and the questions we have around data privacy and the work we need to do in that space. And I encourage all of you to talk about it as well. That's why we've got the social tags up there. Because one of the big theses of what I'm going to be talking about today is how important it is for us to pay attention to this conversation and bring it to the forefront. So this is intended to be a little bit incendiary, but some people think of this as a conflict. We either have to choose innovation or we have to choose privacy. And that line, a very thin line, causes a lot of tension in the innovation ecosystem when it comes to healthcare. But I'm going to try to explain to you guys why it doesn't have to be that way. And we should flip the conversation on what privacy and security is all about. So to start out with, I want to just talk about a few examples. These actually happen to be all Canadian companies who are doing some really amazing things when it comes to digital healthcare. So the first is a smart inhaler. And of course, you look at a smart inhaler, you know what I'm going to be talking about. But this isn't just taking the changes that are happening in the cannabis industry and putting technology to it. This is actually backed by an AI system that gets smarter with every use with respect to specific strains and dosage of the material used for addressing chronic disease conditions in a very specific manner. Something very different. This is telemedicine specifically for dermatology. Patients and clinicians can speak over a video consult to identify the particular situations that are actually happening and prepare a diagnosis and a treatment plan. This device is built out of Montreal. This is an attachment for the knee that diagnoses and provides guidance and recommendation post-injury or surgery for recovery at home. And finally, we're bringing gamification to healthcare. This is a company that's building a consumer system for the management of nutrition, sleep, exercise, and medication adherence and management of chronic disease through a social gamified experience. These are all intended to be and are very, very different. But the question is, why is this stuff important now? Well, if we look at what's actually happening with the healthcare industry itself, we notice some very interesting things. The biggest force in healthcare today is chronic disease: cancer, mental illness, heart conditions, diabetes. And these are all characterized by two very important things: a longer-term relationship with the patient and multiple symptoms and comorbidities. It's extremely complicated. And the traditional method of healthcare is sort of struggling with this being the major force that's existing in the industry. And if you see from some of the numbers up there, a major part of the cost to healthcare as well. Coupled with that is a change in the way that healthcare is actually delivered. The feedback from clinicians is that they have insufficient data, insufficient time, and insufficient context to deliver proper care. And that's leading to misdiagnoses and increased costs from the prescription of unnecessary tests and follow-ups. There was a time when the thought was the solution would be the electronic medical record. And the electronic medical records are very, very important. The quality of documentation has gone up through the roof since the introduction of EHR. However, even though 30% of clinicians say that the quality of patient services is increased and the workflow is increased, 25% of them say it actually got worse, and the rest of them say there's no change at all. It's not that the EMR is the problem, it's that it's not enough. And what we actually need is a cloud strategy for healthcare. So when I think about the opportunity for the cloud in healthcare, I think of three really important things, specifically pertaining to the problems that I just showed you guys. The first is we can make healthcare more accessible. Right now, this is an industry that is on paper, on-premise, in-person, and real-time. But what if we take advantage of technology that allow the patient and the clinician to engage when they're not in the same room together? Telemedicine, robotic surgery, etc. How can we make decisions faster? Healthcare workers have been using precedent and data to make decisions forever, since the beginning of the healthcare industry. But now, if we introduce larger, more up-to-date data sets and decision support through things like AI, we can get to the right kinds of decisions, we can get to them faster. And we can make healthcare work better. We all know, crazily enough, this is still an industry dominated by fax machines and pagers. healthcare workers themselves need better workflows to do their jobs, to deliver better patient care. These are the three things that cloud can enable. And if we're successful in doing this, then healthcare data ends up in all sorts of different places. Hospitals, clinics, insurance companies, public health organizations, medical research organizations. However, this is an extract from the 1964 rewrite of the Hippocratic Oath. And even back then, they said it's a responsibility of the healthcare industry to preserve privacy. Why? Because the healthcare industry has a requirement to do no harm. And if you're now taking ownership of the data of the patients, you also have to protect that. Makes sense, right? Well, that, of course, led to the creation of this thing. So the HIPAA Act is now, a few years old. It's a bit interesting because it was actually created before Google was created. And we started enforcing it in about 2006. And it provided guidance to the industry on how data should actually be managed. We all thought this was going to be a good thing. It is a good thing. It brings privacy and security to the forefront of the conversation. But what we did not expect, especially in 2009, when the breach protocol enforcement was introduced, and the state governors and attorney generals were given the empowerment to enforce HIPAA, and the rest of the world started following suit, including right here in Canada, was how badly we would do. Fines for HIPAA violations in the US in the last couple of years have dwarfed that of the previous decade put together. And this has created a tremendous culture of conservatism and fear. Because the hospitals don't want to be sued, rightly enough. So what do? Unfortunately, this is kind of grinding innovation in healthcare to a halt, which is not what we want to have happen. And it's certainly what we're here at True North to talk about. How do we bring technology to transform things we do every day? And it's not just in the professional realm. Layered on top of that is conversations that are happening in the consumer realm on privacy. We all know about Cambridge Analytica, but do you know about this? Under Armour bought MyFitnessPal, and right after they bought them, they were breached to the tune of 150 million accounts. What diets you're taking, what exercise programs you're on, all of that got stolen. So now everybody's scared. Hospitals are scared, the doctors are scared, the insurance companies are scared, the government is scared, and we are scared, as we should be, because this stuff is important. A health record is worth 35 times that of a credit card on the black market. No offense to my friends who work in fintech protecting our precious dollars and cents, but this is a much bigger problem. And so here's the result of what's actually happening for startups and technologists who are trying to sell healthcare innovations. No matter how good the solution is that you're building, including the 4 or 5 examples I showed at the beginning, you will have to go through a protracted privacy and security review at the healthcare enterprise that you are selling to. Two separate organizations, they actually kind of usually don't like each other very much as well. And it doesn't matter how many people are screaming for the introduction of your solution into the facility. Right now, about 5% of new technologies make it through this review. We all know the sales cycle in healthcare is really long. So don't you think it's going to be really tough to get another chance? Because they're not actually going to tell you what you did wrong, just that you didn't pass. So we have this kind of dire situation. And this is the part that actually kind of upsets me the most, is I meet inventors, startup founders, developers, technologists, even investors every day who tell me this. I was a patient, I was a doctor, I have family who works in healthcare. Healthcare sucks, I want to change it, but I didn't do it because it's too hard. So I went and built an add-on to Pokemon instead, or whatever the case might be. As entrepreneurs, as technologists and inventors, we have a responsibility to solve the world's toughest problems. So this is a really, really big issue. And it's not because people are not trying hard enough. This stuff is difficult. There's a lot of work you got to do as an early-stage technology company to even come close to meeting the expectations of the healthcare industry. Actually, based on the work my company does, this work is about the same or more than the actual work of building your app itself. No wonder things are so difficult. Is this unnecessary? No, it's very necessary. Because as scary as it is that innovation does not proceed because the privacy and security expectations of the industry are restrictive, imagine how much more scary it is if things that are not properly built actually pass. That's where those breaches are coming from. But if we can do this the right way, if we can figure out a way to build a system of expectations around how do you manage privacy and security and actually talk about it as opposed to avoiding the conversation and treating it as something negative, then we can successfully bring more innovations to people who work in healthcare, patients, and those who regulate it. It is possible. We have to treat it as something we're proud of. Treat it as something that if we do correctly, more patients and their families will trust us with their data because we know we're going to take a responsible approach to it. The work that I do every day, fortunately, we get to actually accomplish some of this. And there's some companies building some really incredible things. Patient engagement, medical devices, chronic disease management, healthcare billing, healthcare workflows, medical research, blockchain, AI, VR, mobile, and any other buzzword you can think of being brought to healthcare. It is possible. So here's what we need to do. We need to collaborate instead of trying to each tackle this ourselves individually. We need to establish a set of standards. Because right now, every hospital has their own 50-page questionnaire on their own, completely, of their own questions. They're kind of all asking the same things, but they go, these are our expectations. We don't know about your expectations. We need to create standards that says there's trust in the industry, that if an innovator meets these standards, then they're meeting the minimum expectations of the industry itself. The tricky thing is HIPAA's best efforts. It's not a certification. You're on your own. We got to kind of change that. And when we do it right, we have to share best practices. Talk about it. Let's create a ledger, if you will. I'm not a blockchain expert, so maybe I'm speaking the wrong terms, but that says, here are the things we did, and we passed audits at 6 or 7 hospitals, so that other people can take advantage of the same things we learned. There's another talk today by somebody who is a personal hero of mine, and who's going to talk about the role of privacy, and privacy as a form of tension when it should be a form of empowerment. And she talks about the fact that privacy should not be a zero-sum game. So let's stop that conversation. I didn't want to build HIPAA because I think it's too risky, and I'm going to try to find a way around it. Why would you ever hamstring the feature set of your product just because you're worried about regulations? Build the best thing for the users, the best thing for the customers. And, of course, I can say this in this town, like many other people in the room, including a few familiar faces. I spent a good amount of my time at BlackBerry, and one thing we did really well at that company is we drove a culture of security. It's not for very specific, nerdy people. All of us should be caring about this because we have a responsibility to the users that we serve. So that's my call to action. Let's invite more people to tackle the world's hardest problems. Healthcare is close to my heart. Education, financial services, government, energy and the environment. These are all industries that are well established, have a lot of sedentary expectations, and are highly regulated. And as entrepreneurs, we have a responsibility to change those for the betterment of society. That's where we should be directing our efforts. And if we do this successfully, we can invite more innovators to tackle the world's toughest problems. Thank you very much.